Hello friends, let us now learn some important points about the antitumor antibiotics. In the antitumor antibiotics, we have four main drugs which are Bleomycin, anthracycline, dactinomycin and mitomycin C. So first, if you see, anthracycline drugs include doxorubicin, daunorubicin, they cause valrubicin, epirubicin and also mitoxantrone. So all these are the anthracycline derived anti-tumor antibiotics. Then we also have first, all these from anthracyclines, dactinomycin and mitomycin are actually cell cycle non-specific, whereas bleomycin is cell cycle specific and it is also G2 phase specific. So we will learn some important points about the first drug, that is bleomycin, right? So first let us learn about the drug bleomycin. This bleomycin is a G2 phase specific. This bleomycin is a G2 phase specific. This bleomycin binds to metal ions to form metallo-bleomycin complex. This bleomycin binds to metal ions and it forms metallo-bleomycin complex, and thus it generates oxygen free radicals, and this will induce double stranded DNA breaks and thus initiating the process of apoptosis. So bleomycin is G2 phase specific. It binds to metallic ions to form metallo-bleomycin complex and thus it generates the oxygen free radical and induces double stranded DNA strand breaks, thus initiating apoptosis. If you see the uses of bleomycin, bleomycin is used in testicular carcinoma in the BEP regimen. In the BEP regimen, we have bleomycin, etoposide and platinum compounds are present in BEP regimen, right? Next we have in Hodgkin's lymphoma. The next important thing in Hodgkin's lymphoma, we have ABVD regimen. In ABVD regimen in Hodgkin's lymphoma, there is adriamycin, bleomycin, vinblastine and dacarbazine. All this regimen is used in Hodgkin's lymphoma. Then one more regimen in Hodgkin's lymphoma is MOPP regimen, which is meclorethamine, oncovin or vincristin, procarbazine and prednisolone are the MOPP regimen in MOPP regimen used in Hodgkin's lymphoma. Bleomycin can also be used in non-Hodgkin's lymphoma and it is also used in squamous cell carcinoma of neck. Then if you see the pharmacokinetics of bleomycin, bleomycin is mainly metabolized by hydrolases. It is metabolized by the hydrolases which are present in liver and spleen. This bleomycin is also present metabolized by hydrolases. These hydrolases are actually present in lungs, and as a result these will result in side effects. Because these hydrolases are less in lungs, this bleomycin is in more concentration in the lungs, thus it causes side effects like pulmonary fibrosis, it causes necrosis of type 1 pneumocytes and it causes compensatory hyperplasia of type 2 pneumocytes, and thus it decreases the DLCO and pneumonitis, that is diffusion limited carbon monoxide. It decreases the diffusion limited carbon monoxide concentration and it is also used in pneumonitis. Then these hydrolases are also absent in skin. Because the hydrolases are absent in skin, it can cause hypertrophic skin changes, it can cause hyperpigmentation, hyperkeratosis, erythema, ulcers. It can also cause mucocutaneous reaction and it can cause hypersensitivity reactions can occur if these hydrolases are absent in skin. Then Then if you see the uses of these drugs, then these if you see the uses, we can use this Bleomycin in, first it is used in Kaposi's sarcoma, where the regimen is ABV regimen, which is Adriamycin, Bleomycin and Vincristine. The second regimen is for non-Hodgkin's lymphoma. For non-Hodgkin's lymphoma, we have R-CHOP regimen, that is rituximab, cyclophosphamide, hydroxydoxorubicin, hydroxydoxorubicin, that is doxorubicin, oncovin or vincristine and prednisolone. Non-Hodgkin's lymphoma, which is R-CHOP, which is rituximab, cyclophosphamide, hydroxydoxorubicin and doxorubicin or doxorubicin, oncovin or vincristine and prednisolone. Then it is also used in testicular carcinoma, has BEP regimen, has already said, that is Bleomycin, etoposide and platinum compounds. It is also used in Hodgkin's lymphoma like ABVD regimen, which includes Adriamycin, Bleomycin, vinblastine and dacarbazine. So if you see, the Bleomycin toxicity may become apparent after exposure to transiently very high partial pressure of carbon dioxide. This Bleomycin dependent electron transport is dependent on oxygen. So this is about the Bleomycin. Thank you for watching.